I'm currently 61 years old, physician who was found with a malignancy of one of my breasts about 4 years ago, and treated at that time conventionally with surgery and chemotherapy. And then I had a few years of just normal life until last September. So in other words, about 8 months ago, when I was found with extension or dissemination of my condition of the cancer in my whole body, or approximately in my whole body. So that was they were bad news for me, because I didn't expect that to happen. Okay, given the fact that my cancer was found in a very early stage 4 years ago and treated more than appropriately at that time. So a few months ago, I was facing with this terrible news, and of course I was overwhelmed by those. And my oncologist advised me to follow with the traditional treatment, which is basically, as you know, consistent of chemotherapy, radiation, surgery if needed, or one of the three or all three together. So after a little while, I decided to go on chemotherapy, as he recommended, as the only tool that I probably was able to be given at that time. My disease being in stage 4, in other words, considered terminal. So I began the treatment one single chemotherapy drug, because even the treatment is usually done with several chemotherapy medications. I was not able to, not to tolerate others, but I was not responding to the others based on some testing that they did previously. So I had to do the treatment one single chemotherapy drug, which is definitely insufficient, but they tried it anyway. So I decided to go for it, but at the same time, I happened to find out about this clinic, Nova Vita Clinic. The first contact, actually, I found out about the clinic through a newspaper, which was actually a Romanian publication. And I began to search within the context of the article, and talking to several people that actually went through the clinic, you know, in different stages of their diseases. I contacted them by email and by phone. So I talked to them a little bit, so I knew what was happening. And then I got some information about the, you know, cost of the treatment, and other things like this were very practical. And if I could have some treatment from far away, because at that time I wasn't in the States, so I couldn't come to Belgrade to get the treatment and so on. So I was treated kind of with like a maintenance therapy, okay, from afar. And in making contact with them and telling them my history and, you know, a brief situation of my case, they advised me to also take some of one of the products in the same time as I was doing chemotherapy. What's interesting in that is that during my chemotherapy, I had several complications from my condition, from my disease, secondary to a liver biopsy, which actually brought me to being almost dead. You know, I was in intensive care unit for about 10 days with big hemorrhage in my belly and a condition of the lung, which was very difficult to treat. That was within the time when the chemotherapy was supposed to be done. So the chemotherapy was stopped, okay, for at least 2 weeks or 3 weeks, basically. So I was not having a continuation of the chemotherapy as it's supposed to be. And my physician at the time said, oh, you're going to be on this therapy for at least 6 months in your case, or maybe longer than that. So even given this this interruption of my chemotherapy, 3 months down the road, you know, since January until April or the end of April, when they did my second scan, or a PET scan, compared to the one done in January, which shown in January when they showed the full blow of my disease. Now 3 months down the road, even with the chemotherapy, which just was interrupted, as I told you, while being on this product, one single product from Nova Vita, my PET scan, the scan was found basically normal. So there were found no metastases in the body, nothing in the bone, nothing in the liver, nothing in the lung, where they actually were before. So they said, well, you have to stop. There's no need for taking more chemotherapy. So you, from our knowledge, you basically not cured. Let's not use this word, but definitely a total remission. So whatever you've done besides our chemotherapy, which was just a minute help, continue to do it, because we don't know what it is. It's just a kind of a miracle. So that's, in short, my story. Definitely, this is a naturopathic clinic, okay, that deals primarily with products and interventions aside from the traditional way of treating cancer patients. We all know that the naturopathic approach to the disease has been the first one since long time ago, and then the traditional medicine nowadays is kind of copying or manufacturing products in resemblance to what is natural. So these products are done synthetically, has some resemblance with the natural products, where the herbs or whatever, minerals, whatever people used to use in the past, 100 years or 1,000 years ago, and we just copy those products and trying to deliver them in larger amount to a larger population so we can cover the field. The clinic itself has a very solid understanding of what a cancer patient has to deal with. And this is something that a lot of people don't understand, including us as doctors. We treat the disease, we don't treat the patient most of the time. Although, it's the patient, not the disease that you should treat. Diseases are all the same, or same disease that can be in 100 patients, yet about only 2 of them will respond favorably. Why? We don't know. But this clinic apparently knows why. So there is a whole approach to the patient, to the cancer patient, that is done in a fashion that it's assembled, okay, not in a way that's not rejecting the traditional type of medicine like the oncologists deliver, but incorporates that, allows that to be taken. Every patient is allowed to continue with his therapy aside from the clinic. And on top of that, the patient is given a therapy that's naturopathic, and I'm not going to describe the type of therapy here and so on, but it's very complete. It makes sense. It makes common sense, I would say, because the patient is treated as a whole, okay? Is not treated the disease, but he's treated in the whole sense, It is treated primarily psychologically as well, because this, at the very end, it's a psychological condition that you have to deal with. The disease itself has its own course. You might feel any pain, no distress, but your mental aspect is distorted. You live in your own world that no one understands, okay? So that not that you're gonna die sometime, but you know that you're gonna die for sure. So that's the difference from someone that is not sick, that's someone that is sick with this particular condition that apparently has no cure. So the clinic, I told in the beginning, that has a comprehensive, solid understanding of the situation of a cancer patient, starting even with the very aspect of the room, okay, of the food that he's eating in the clinic, the psychological approach that he gets from a psychologist, from the doctors and nurses that work in this clinic. They're all on a 20-hour shift, okay? There is not a 8-hour shift and afterwards the clinic is empty of any professionals. No. It's 24 hours of constant attentiveness to the patient. So that gives you, and I'm talking about my own experience, being a doctor and knowing so much about it, I could get cuckoo, could get crazy about this condition, which actually is going to kill me, presumably. I don't believe so, okay? And this belief comes from the fact that this clinic helped me quite a bit in terms of giving me hope and the dignity as a human being, okay? And I know how people feel in a hospital, regular hospital, the oncology patient, cancer patients. And in talking to some of the folks that are in the clinic, including some from Romania, okay, they have from the beginning very impressed with the fact they live they've never been in this, in a place like this ever, okay. It's comfortable, so pleasant, so well taken care of. The people are all very kind and understanding and professionally prepared to deal with this condition.